We're here.
So today we're going to go over what the heck do us chiropractors even do? What do they do? And I feel like, especially like when I talk to different people, you go out and someone finds out you're a chiropractor. Most people are very interested in it, which is really cool. Well, they're either really interested or they start grabbing at their neck or something, which is kind of funny, too. And I'm like, I love that stuff, but I'm out here like eating dinner, so, but it's all good either way. But like, I know like there's a lot of different opinions on what we exactly do. And then if you go to different chiropractors, like a lot of people have, they kind of have a different experience at each chiropractor. But and while chiropractors are different, we all are achieving the same goal. So we're going to go into, and I'm going to pass it off to Dr. Aiken, kind of kick us off at the base level. What do we do? What do we do for our patients when they come in here?
I always like to really in our realm, our field is we are doctors of the spine. Mm-hmm. We know every single part of that spine. We were drilled on it in school. We went through national board exams to understand how it moves and what to avoid and what to watch for. So, and by watching for it's like red flags, and so really in reality of it, man, again, I'm going to share it again and again, how fired up I am with the way the healthcare system is transitioning. And I'm half full here with the glass, man, because we are in a unique wave of healthcare. Things are changing. We're understanding that holistic living is really the way to quality of life. Mm-hmm. And so as chiropractors, we address, with a detailed history of patients' spinal health. Not only that, but what's going on in their mental health, what's going on in other avenues of their health. Even if we can't help them, we can refer them out to where they can be helped. And so by restoring the motion in the spine in a proper way, we're philosophy-based chiropractors. We take an x-ray. We want to know exactly what bone's causing the issue and how specific we need to move the bone and how often. And so chiropractic is more than just a snap, crackle, or pop. It's really just like your mechanic looks under your hood. When we're looking at that x-ray, we're saying, okay, here's what's causing your issue. Here's what could be happening down the road if we don't do something to correct it. Man.
Yep, absolutely.
And that's the beauty of our profession too. It's like, not only was the nerve compression that comes out of his lumbar spine going to his intestines affected, but then he might have had some mental stress. He might have had some diet changes he needed to make. So he's got 6 different stressors invading that system. And like you had mentioned, and we don't want patients or the population to take us wrong here, but our job's not to chase your symptoms because the body's a big puzzle. It'll tell us what we need a lot of the times with your history exam and your x-ray. Mm-hmm. And then we start restoring motion into the spine, which is taking lactic acid out of those joints, taking out inflammation. Patients are feeling better because the same hormones due to the compression on those nerves of your lumbar spine are released. It's again, going back to the nervous system. So stress is stress. So the same type of hormones that are being released are the same hormones released in your mental stress, same hormones that the chemicals in the food that from Mickey D's are causing to your guts. It's all stress. And if we can eliminate some stress, then we feel relief. The slightest amount. I mean, how many times on day one you just give some relief treatment and you see the patient light up?
Yep, makes a big difference.
You've eliminated a component of stress from their body. And the difference, but the understanding of chiropractic needs to be that if we can analyze the spine altogether and we can eliminate pressure and noise throughout the system, pressure and noise being stress, whether it's sitting, looking down at your phone, those are all causing imbalances and pressure and stress on your spine.
Yeah, and when Dr. Aiken, just kind of clear this up for everyone, when Dr. Aiken talks about stress, it's not just mental stress. It's stress being put on the body for whatever reason, whatever you do day to day, sitting, digging holes, whatever it is, those are all stressors to the spine and to the nervous system.
And the fascinating thing about the human body is that it's always adapting to stress. So that could be stress from work, stress from traffic, stress from kids. Any type of stress can affect the body. And if the body knows how to adapt to the stress, there's no effect on the system long term. And I think chiropractic in itself restores motion into the spine, yes, but it makes the spine more resilient and able to adapt to stress. Yep. And so what happens if you can't adapt to stress? What happens if you can't adapt to emotional stress and then you move on with life? it resides in the body.
Yep.
The same with physical stress. So the body can't tell the difference, but if we can eliminate one aspect or area of that in a specific, appropriate manner, the quality of life improves tremendously, man.